in January of this year and already has done a ton of work. Dr. Medlock received her MPH from Harvard T.H. Chan School of Public Health, her MD from the Mayo Clinic School of Medicine, and her MDV from Andrews University. So please give a warm welcome. We couldn't be more happy to have Dr. Medlock here with us today.
Thank you so much for that warm greeting, and good morning to everyone. Really a privilege to be here to talk about this historic moment. I think our assignment today is to clarify how the Behavioral Health Administration seeks to partner in order to really uplift lived expertise across this state as we think about how to use funds in a community-centered way. We really do view ourselves as the people's agency. We were willed to exist by diverse communities across this state who literally insisted that we come to be, that there be a behavioral health administration to really drive coordination across all state agencies. And so we take our stewardship very seriously in terms of representing lived expertise in diverse communities across this state. So we were hoping today that our talk would be people-centered and would reflect who we believe we were called to be by the people of this state. So I want to just talk today under the title, People-Centered Values and the Power to Heal. As we clarify what the BHA is, again, we view ourselves as a steward of this amazing vision that has been decades in the making and really concentrated over the last 3.5 years with the Behavioral Health Task Force that was commissioned by Governor Polis. But in short, we are the new cabinet member-led agency that is responsible for driving coordination and collaboration across all state agencies in order to address behavioral health needs. And to that point, I want to highlight that a historic convening of all cabinet agencies has already occurred in this state. For the first time ever in the history of this state, we launched the Behavioral Health Interagency Council earlier this month, attended by all cabinet leaders. It was fascinating as we came together to talk about how do we drive this vision irrespective of how people pay or what their identity or background or their experience with a disability is. How do we ensure that we're building a people-first system? And the reason we do this work with the heart of a steward is because we believe that all people in our state deserve to experience whole person health. And because of that belief, we envision a whole new world in which behavioral health services in Colorado are accessible, meaningful, and trusted. And very soon, we will become the first state in the nation to launch an access to care methodology based on those 3 words: accessible, meaningful, and trusted. What does that mean as we think about data? What does that mean as we think about equity, and so forth? So we've made it our mission to co-create this thing with you, to co-create a people-first behavioral health system that truly meets the needs of all people in Colorado. Well, indeed, we were created by the people, and so the BHA is for the people. We were conceived by community. This vision was brought forth by community. And so I want to just walk you through our values commitment, both to you and to the people of this state. As we thought about our values, we engaged in a brand survey across this state. Nearly every county responded. It was amazing. And they asked us to, as we think about every meeting that we call in the BHA, that we think about our first value of truth. There is a need for truth-telling in this state, of being transparent and accurate when addressing the people of Colorado. That is closely linked to equity, because truth-telling means that we name root causes of injustices, including racism and how the opioid crisis was even discussed compared to the cocaine crisis, and allocating the necessary resources to support desired outcomes. And that's the moment that we sit on the precipice of today. Our third value is community-informed practice. In other words, we believe in the integration of the best of science and evidence-based and promising practices in other states and around the world, but balancing that with lived expertise so that we really choose the right programs and initiatives for our state and for our communities. Our fourth value is collaboration. And again, we are the agency that is intended to work in partnership with community and with state agencies to realize this holistic behavioral health vision. But it's not just about mental health, it's about whole person health. And our final value is so meaningful as we think about generational impact. We are seeking to be the state agency that creates sound decision-making today, hoping that it will lead to healthier individuals and families 3 generations from now. We want to engage in meaningful and thoughtful action in order to create a new legacy. Well, we cannot overstate the urgency of this moment. And as we think about how to use funding, the reality is that our state is in crisis. And so as a crisis psychiatrist, this role of commissioner has really expanded my view of now I am a crisis psychiatrist for a state, because this state is in crisis. I mean, the urgency of this moment, right, where we have 1 in 3 adults who are saying they have struggled with anxiety or depression this year, where we have 33% of our kids who are saying they feel hopeless, where we have, in 2020, and this is true for most states, the highest year-over-year increase in opioid overdose deaths, and where the reality is that even before the pandemic, many residents of our state had higher rates of mental health challenges compared to the rest of the country. And so it's a historic moment in terms of need, and it's a historic moment in terms of funds. And yet the reality is that while we have a historic inflow of funds, we also have historical trauma to reckon with in this state. And as I seek to tell the truth today, I have to say that the truth is that an influx of dollars will not heal community trauma. It will not heal historical trauma. To heal trauma, yes, we have to use the funds in a community-centered way, but we also have to be authentic and genuine in how we tell this story. Because the truth is that people of color in this country, and especially Black identifying individuals, are more likely to be incarcerated than treated if they also struggle with a mental health or substance use disorder. And we have to acknowledge that story. And the truth is that many of the communities that we are now approaching with historic funding experience this unjust shift in how resources were allocated as they watched as their own family members and my own family members remain in prison for things that are now legal. We have to acknowledge that racism led to the shift in how we talk about substance use disorder. That in the 1980s, the cocaine epidemic that primarily influenced minority communities, we talked about drug use as an academic community in terms of character flaws and criminalization and sentencing disparities and punishment. And then all of a sudden, when the demographics of those who were harmed began to shift, now the academic community responded, and we began to use words such as disease models, decriminalization, sentencing reform, and treatment. There's a fantastic article in Archives of Internal Medicine that acknowledges that the cocaine mortality rate in the 1980s approached the mortality rate of the opioid epidemic. And yet, in the 1980s, widespread deaths in minority communities were not reported, they were neglected, and in fact, those individuals were incarcerated. But in the 2010s, deaths among white communities were widely reported and responded to, and laws were changed to provide new forms of treatment. We have to acknowledge this as we approach our communities with historic funding, because they, in fact, lived this history. And so as we think about community-informed practice, it means that as we approach communities with historic funding, we have to bring to bear their own cultural framework. We have to talk with them about, hey, given this history of what has happened, what is the appropriate cultural framework for even talking about this opportunity that we have? The BHA has been challenged with standing up a community-informed joint information center where communities of color across this state want to be part of how we even language the issues around substance use disorder. I think that's very powerful, and we're committed to that. We also have to be committed to a structural framework. of helping our communities understand how historic policies and politics shape the current activities and how they can be involved in helping us create new policies to create a new legacy. We believe at the BHA that meaningful collaboration includes an acknowledgement of harm done by past practice and policies. And in fact, it's because harm was done that we have these funds. I was really challenged at a recent meeting. We're about to launch our Lived Experience Council in the BHA. And someone challenged me that, Dr. Medlock, when you talk about harm reduction, don't just use that term to talk about how communities need to change. Use that term to talk about how you need to change. That harm reduction means changing how you talk about us. Wow. I was really challenged by that. But we're committed to the authenticity that it takes to really create generational impact. At the BHA, we believe it takes this kind of truth-telling in order for there to be reconciliation and in order for there to be meaningful and thoughtful action to create a new legacy. Here on our panel, you're going to hear from experts today who are going to uplift how we use funding, not to just create new programs, but how do we create benevolence out of adversity with these funds? How do we create a new opportunity for marginalized communities to feel that they're part of a powerful healing process? To heal and recover, we believe that our communities, first of all, must be approached from a strengths-based approach. So we are not bringing solutions to our community, but we are bringing solutions with our community. It's our goal at the BHA to be a community anchor. We want to support the work of advocates and leaders across the state to be innovative change makers, setting a new standard for equitable care across our state. Again, we believe that the best use of these funds is to use a framework of not bringing solutions to deficit-based models of community, but bringing solutions with our communities, understanding that they exist in a system where their strengths have intentionally not been highlighted or uplifted. And so at the BHA, we bring our values to life by, first of all, thinking about everything from a people-first mindset. I think there are opportunities for us as we think about these funds to center the voices of lived expertise and those who provide care to the most vulnerable across the state. We invite systems thinking. In other words, not only how do we infuse funds, but how do we push the right policy levers going forward to really think about that impact 3 generations from now? We invite proactivity and boldness, and as you can see, truth-telling. I want to end here that at the BHA, we reflect on this in every senior leadership meeting, that we can't do anything for the people of this state without them. Nothing for us without us. In other words, funding on its own does not serve the people of this state. Good funding is actually rooted in our people's needs and our systems processes. We think about 3 things in the BHA: people, process, and performance. And here's how I can best articulate that. We need to listen to the people of Colorado first. We need to establish processes that support people. And then we need to thoughtfully systematize the ways our people can actually engage in state processes. Thank you for listening. We are your BHA. You can stay connected to us. All right. Thank you very much. You can find us online at bha.colorado.gov. Also want to highlight that we just launched our brand new behavioral health care directory, ownpath.co. Thank you so much.
What a moving speech. Thank you so much, Dr. Medlock. You do not disappoint. One thing that stood out was just this comment about the reason we have these opioid settlement funds is because harm was done. And so I think that just grounds us today in the work that we're doing and why we're here.